It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
One of the many conditions in the spine is called stenosis. So if you get a narrowing of the canal where the spinal cord and the nerves are going, and you get some combination of pain, weakness, and numbness. And so that's like in Craig's situation where he had very severe stenosis.
I'm in the limousine business here in Dallas-Fort Worth, and many times it was painful to lift, heavy bags up into the car or into the trunk or out of the trunk. Standing for any great length of period of time was painful. And so I contacted Dr. Kaufman, and we went forward through the process of getting me fixed up.
Once someone has failed, conservative measures would be to unpinch or open up the canal where the spinal cord and the nerves are. And so we call that a laminectomy. So the lamina in Latin means the roof. So the roof of the spinal canal. We unpinch the canal and unpinch the nerves so that they can function normally again like they were.
First thing we did was we did x-rays, and he had me get an MRI to find out what the issues were. And in fact, the MRI showed that I had a small crack in my vertebrae, and obviously was compressing the nerves. The solution was that I needed surgery, and that was probably going to be the only solution to it.
And so in Craig's case, he had horrible stenosis or pinching, and so we went in and put the screws in and the rods and stabilized his spine.
I feel fantastic. There is absolutely no limitations that I have experienced whatsoever. The professionalism, but yet at the same time, the friendliness and the environment of being put at ease about having what is a major surgery. I have recommended Dr. Kaufman in many cases to clients and friends of mine. He's probably done maybe 5 or 6 surgeries on them, and all with great results.
I'd been working on the fascia of my house, replacing some things, and about 3 days later, my shoulder just started aching and terribly. I couldn't hardly move, I couldn't sleep, I had so much pain. I went to my regular doctor, put me on pain pills, thought it was a pinched nerve. 2 weeks later, it hadn't done any better, so I went and got an MRI on my shoulder, sent me to another doctor, orthopedic guy. He said it's not my shoulder, it's my neck, gave me another MRI, and said I needed to see a neurosurgeon.
If a nerve gets pinched from a herniated disc, then you'll get some combination of pain and weakness and numbness.
From the MRI, they found that the discs in my neck, vertebrae 3, 4, and 5, were pressing on my spinal cord, and I was losing function of my right arm.
In Joel's case, the nerve that goes between C4 and C5, Joel had a herniated disc there, and so he couldn't raise his arm. And so an anterior cervical discectomy fusion is where we make a little incision and we go down, dissecting carefully to the anterior part of the spine and cut whichever discs out that are degenerated or herniated and unpinch the nerves.
He said, okay, we got to operate. It's very simple. We just go through the front of the neck, take the old ones out, put in spacers, and put a plate over it, and you're done.
He had tried numerous conservative measures, including physical therapy, injections, traction, medications, and ultimately ended up in the surgical route.
So a week later, I had surgery. 2 weeks later, I was back at work, full motion of my arm, and I'm in rehab now to get the muscle strength back because it's very weak.
So it's about a 1 day in the hospital and 2 months of recovery period.
It's wonderful. At least I got my arm back, and things are hunky-dory. I'm very happy.
He had an excellent recovery. He is back to work and has full range of motion of his shoulder and arm.
He's one of the best surgeons I ever have met, and I would recommend him to anybody. He's great.
Ronald Miller had what we call mechanical back pain. And mechanical back pain is where the stabilizing elements of the ligaments, the discs, and the vertebra gets compromised due to degenerative changes over the years.
My lower back was getting to where it was pinching on me more and more and more. I'd go out to play golf. I'd hit a drive on the first hole. I'd go hit the second shot. It would pinch and grab me and just about bring me to my knees.
The surgery that we opted for was what we call an anterior. Anterior means coming from the front. Lumbar, inner body. Inner body means between the vertebral bodies, fusion.
They went in through my tummy area and actually replaced the disc. And then 3 days later, they went in, and in the back side, they fused with some sort of a basket. And then when they tightened up all the screws, it basically pulled everything together like a vise.
Once we take the disc out, we put a little, this is a spacer, we fill that with bone graft, slide that into the disc space. We put little plates on the front, and then we do make a little incision in the back and put the pins in the back, the screws, to hold things together.
I was told that my recovery period would be a 4 to 6 month time frame. And quite frankly, it was pretty true to that.
Surgery takes about 3 hours. It's about a 2 to 4 day hospital stay. 2 weeks of what we call downtime, no bending, lifting, twisting. 2 weeks after the surgery, we see him back in the clinic, take the stitches out, and then 2 weeks after that initial visit, we start him in physical therapy and outpatient rehabilitation.
When I'm out on a golf course and I go to hit a shot, I don't have that concern that I'm going to wrench my back or I'm going to end up with a sharp pain coming up through my back. Dr. Kaufman is trained in understanding how the nervous system works and how your spine works, and I have no reservations about referring anybody to Dr. Kaufman.